The biopharmaceutical drug market is expanding at an unprecedented pace, fueled by groundbreaking innovations and the rapid adoption of new therapies. But with progress comes complexity, soaring costs, evolving regulations, and persistent access challenges. How is the industry adapting to navigate these hurdles? And what strategies are unlocking new opportunities for patients, providers, and innovators alike? I'm Michael Sarshad, your host, along with Sarah Rubin, for this special series of the Syneos Health podcast in collaboration with Assembia and the Specialty Pharmacy Summit. In conversation with key thought leaders and industry experts, we'll explore the dynamic forces shaping the market today. Tune in as we discover key strategies, industry trends, and collaborative innovations driving the future of market access and specialty pharmacy. Welcome to the Syneos Health podcast, Navigating Modern Market Access. I'm Michael Sarshad at Syneos Health and your host for this episode of the Syneos Health podcast series, Navigating Modern Market Access. We're recording from the floor of Assembia's AXS 25 Summit, and today I'm joined by Kim Plesnarski, SVP Market Access and Patient Support Services here at Syneos, and Greg Morris, Chief Strategy Officer of CareMetx. Welcome.
Thank you.
Thank you.
We're towards the tail end of the conference now. We've had a lot of great learnings and exciting things that we heard about. Anything off the top of your head that really stood out for you at the conference that makes you super excited moving forward, or you're really interested to see how it plays out, or a new trend that you learned?
I would say just walk the exhibit hall. There's lots of new companies that weren't here even a year ago. Lots of people with AI solutions. We're at a time of tremendous innovation in patient services. It's exciting, and I think it's going to be fun to see the impact a lot of these organizations could make.
I agree. The major hot topic this week across all the sessions is how to integrate AI, how you need to reimagine the way you work with AI, and how you're going to redeploy patient support in the future, and really a shift to be more customizable and personalized with patient engagement. I think that's where a lot of the companies are popping up with solutions around that. So it's really exciting to see pharma try to get with the rest of the world and technology, and that's where we're headed.
You both brought up some of the trends with patient support services. What would you say are maybe the biggest challenges that you see with the way that we operate patient support services today?
I think today support programs are set up to be very reactive in nature. We wait for there to be a problem and then attack it. And where we need to shift, and the technology and data is there, is to be more predictive in nature and have better precision targeting of where you want to play, where you want to give support, and deploy these precious and really valuable and not cheap solutions.
I don't want to contradict my last statement, but so many organizations who run patient services programs, they really slow to respond to innovation. And a big part of it is just the lack of technology resources or the product roadmap to do a new integration and get something done. So it's very easy for organizations to get stale on a relative basis if they don't continue to innovate.
And just piggybacking off of that, so many programs are set up and then they forget about them.
Oh.
And then a few years later, they're like, I don't like this, it doesn't work. Let's get a new partner, let's blow this thing up. And really what they should be doing, to your point, is keep measuring, evaluating, and evolving. And I just couldn't agree more with that statement. And we see it all the time. We're both smiling because that's what happens.
So we hear a lot of different things around insourcing versus outsourcing. And there is a potential perception that insourcing is either more efficient, more effective, better long-term solution. And sometimes there's a place for outsourcing as well, but things that we think about and always evaluate as we're moving forward. What is the general consensus for both of you? Do we think that insourcing or outsourcing is one better than the other? Should a company always go one way? Or are there certain conditions that would push you in one direction versus the other?
There's definitely a trend to insourcing right now. Large pharma with dozens and dozens of brands have the ability to take the investment in a Salesforce platform and scale it across many brands. So theoretically, it can be more economical. The other thing that we see a lot is that rare disease programs that need super high touch will want to insource because they want to be in control of the patient and even the provider experience. We see that all the time. And we also are starting to see more and more of, the industry calls it a hybrid hub model, which basically means I'm going to do the services that are important to me. And normally it's the patient or the provider facing items. And then for some of the back office things like insurance verification or prior auth support, other things of that nature, they outsource that component of the service. It sort of gets at the best of both worlds where they get to engage with their customers and control that experience, while they may pick up some economies from organizations that have more scale in that particular back office function.
Right, or some tech solution that is supporting that.
Absolutely.
At the end of the day. Yeah.
I totally agree. There's a lot of hybridization happening, and there's not a straight yes or no answer. The answer is it depends on your goals, and there are certain benefits to doing it and certain benefits to insourcing, and there's a lot of, I think, misconceptions on how to partner. When you're thinking about making an investment or owning your technology, it's really great when you first do it, but is your company going to continue to invest and be top of the line? And do you have the right talent to build AI agents? Do you have pharmacy capabilities in-house? Probably not. Do you want them? And you should really be selective about your partners and pilot. Otherwise, your tech is stale after a year or two. So that is a key consideration. I think with talent, there's a thought there's more control. Find out from your partners what control you do have. There's probably quite a lot. With these programs, to make them effective, you have to be able to scale up and down quickly. If talent's not getting it done, they're representing a customer service standpoint. It can be quite disruptive. You have less ability to move talent around when they're yours, but if you work with a partner, they can reassign them to another team where they'd be better suited. So there can be a lot more control, potentially, and it just depends on what you need to do. And when it is your own talent, you have less flexibility in going up and down. So we do see a lot of partners want standalone, and we plug their capability gaps. We hire individuals for them. And we see a lot of partners do the hybrid model where they say we have some core staff of our own, and you are how we scale up and down, how we pivot quickly, and then we plug some of those capability gaps, whether they be in data analytics, reporting, technology, et cetera. But I think the answer is, what are you trying to accomplish? Can you do it yourself? And what do you really want to take on and invest in? And what do you need to de-risk? You might change what you're doing now based on that answer. And just with complexity in the marketplace, the speed that technology is moving, I don't think it makes a lot of sense to do everything in-house. You're going to get left behind.
I agree. And what's interesting is you brought up efficiencies. I think most manufacturers that, at least in my experience, particularly the large ones that are doing it across multiple brands, they didn't do it because they think it's going to be less expensive in the long term. I think most of them would tell you it's probably more expensive. They do it because of control, whether it be of the data and of the reporting or of the product roadmap, so that they can prioritize resources. There have been longstanding industry third-party players that are notorious for, you got 9 months before you can start your project. And if you got an important critical issue, you can't wait 9 months. They want to get out of that world, so to speak. Our clients that have gone through these internal processes, from our standpoint, we are a hub, but we also technology provider. And our scope of the work that we do often expands rather than getting smaller when they internalize hubs. You wouldn't think that'd be the case, but we're able to provide high value tech, and we're happy to unbundle that tech and power third-party programs. And I think most people in the industry are. And I think, Kim, you bring up a good point. The relationship matters. How you partner with somebody really matters. You can get to great outcomes in hybrid models if you do it right.
The thing that I love that you both brought up was technology and the role of technology, but also what technology gets outdated very quickly. It almost has to be part of your 5-year plan to say, hey, it's not just about investing this year or next year. It's about, am I going to invest continuously over the next 5, 10, whatever the number of years is, to make sure that, one, I've got the initiation of it and development, but also upkeep, and am I continuously improving it over time? But if that's not the business model that we have in mind as a client, then that's not something that we should embark on, because then you're almost wasting that time and effectiveness that you could be utilizing for other things.
I could not agree more. We talked about all the new companies popping up. That is their sole focus and mission. 100% of their resources are going into evolving the tech. They work across many companies. If you're doing it yourself, your talent is stale after 2 years and your tech is stale. So unless you have an innovative model to keep bringing in fresh ideas, people, you could do that with consulting. There's a lot of ways to do it. I just don't think it's sustainable. And your peers in pharma who partner selectively or just totally outsource certain things, they're always going to be on the latest and greatest.
Right, because they're at the cutting edge of the trend because the vendors need to be.
Innovation is something that you need to plan how to do. We talked about finding the right partners. We believe strongly that what we want to be doing is providing, I'll use an analogy like an app store. We want to have hundreds of different services that a manufacturer with an internal hub on Salesforce can reach out and use any one of them at any point in time. We want to partner with someone to be their innovation center. And we don't have to build everything because, Kim, to your point, there's always going to be someone that's more focused on an issue. We really believe strongly that there needs to be marketplaces in patient services. And in that marketplace, these best-in-breed vendors can plug into that marketplace, and then any manufacturer can plug in and say, I want to grab that piece of functionality and easily implement it. One of the big challenges within Salesforce is the implementations of these smaller best-in-breed vendors aren't easy. And manufacturers need to recognize that when they go on Salesforce, most of the rest of the ecosystem they deal with is not on Salesforce. Sometimes it's easy to get so internally focused that you forget there's providers that want to access your services in their workflow. They don't ever go to Salesforce. And you need to have a plan to make sure your services are moving into their workflow. I mean, you talk about a trend, that's a huge one. We're seeing more and more, lots of specialties, they want one place to go to do an enrollment or a benefit verification or a prior auth. They want to go for all brands, not one.
Yeah, it's that integration.
Yeah, and so as a manufacturer, even though you're internalizing those services, you better have a service strategy that is thought through how you move your services outside of the walls of your call center and into the provider and patient. Along with that, you also need an innovation strategy because to do those things, you're going to have to be pretty creative and you're not going to build everything in Salesforce. I would argue that manufacturers do lots of things in Salesforce that are probably outside of their core competency, or they're not the thing they should be focusing on. Why am I trying to maintain 27 different integrations with 5 copay vendors because I have 12 brands that each one has a different one? And I'm maintaining a connectivity, and every time one of those things changes, something else in Salesforce breaks in testing. Find a single partner that can manage and navigate those integrations and can be also that integration strategy partner.
You guys touched a little bit about the best practices and what to do. What about a common mistake that you see in overall patient support program design for a brand, not just hub services, but all services? How would you advise partners to avoid whatever that mistake is that you envision, that you see pretty commonplace?
Especially early in a manufacturer's time when they're insourcing. They have untested business processes and technology processes. And it's hard to get that stuff right. Things like data intake are incredibly tedious. And manufacturers will spend a ton of time and go way over budget trying to perfect those processes instead of spending all their time figuring out how do I do a better job with the patient experience, or how do I do a better job with something else that's important in my business. With these hybrid models and with tech in today's age, there's no reason you need to even build out an intake function in Salesforce. You can have people set up patients remotely into your Salesforce platform. It's a different concept. People don't necessarily think about it that way, but build the things that matter to you and your key stakeholders, and the heavy process things, let people that do that stuff at scale continue to do it. It doesn't matter how many brands you have or how many patients you serve. As an individual manufacturer, you're never going to be at scale the same way a service aggregator is that does nothing but that piece. And you're not going to be able to keep up with innovation in those same things.
Kim, what about you?
I'm going to pick some different ones. The first one might sound insane, but I see commonly the design is based on their own internal legal compliance regulatory landscape and not the market's legal regulatory compliance landscape. I would suggest saying this is what needs to be true to be successful in the market and support our brand, and work backwards from there. Oftentimes, it's like, we're not allowed to do that, so we didn't even try. I'm like, did you ask? Because this is a different situation than that other brand, and it may make sense here and not there. So I think that is a very quick win, is really sit down and partner cross-functionally and talk about what you need to really support patients and figure out how to do it. You might be able to do it. It just has to be outsourced. It might be that. You might be able to do it, but only under these type of brands. You don't assume. So I think that's the first one. And the second is also an easy win. It's aligning incentives and building around that. Oftentimes I see, we know we're not going to have coverage, so we'll just do quick start or free samples. Oh, then we don't need a lot of people at the hub, or we don't need FRMs until we have coverage. And your incentives aren't aligned because your sales team is going to send every star form into the hub. Now they're understaffed. Yes, we're not pursuing paid therapy because there is no coverage, but who is taking all of that in and working it and engaging with the HCPs? If you don't have FRMs and your sales reps aren't doing it, who's engaging the physicians and their staff to let them know coverage is coming? And when it does, you'll have to do it prior auth. You really wait too long because your incentives aren't aligned. I'd say take a step back. What are you asking each team to do, and make sure the other team is equipped to handle it and understand what the implications of some of these strategies are. If you do a lot of fast start, you can't always take patients. If they're a Medicare patient, you can't take them off until the end of the year. This is free product. It's volume without any reimbursement. I would say take these two, they're easy wins, and do the things that Greg mentioned, and you'll be ahead of the curve. And just don't assume. And just full disclosure, I outsource talent. Prior to coming to Syneos, I worked in pharma, and I outsourced because I believed in it, and I saw a lot of efficiencies. And I'm just surprised networking, and in this job, there's a lot of false beliefs because people have not had to manage a partnership before. And that's really different than managing your own team. But it can give you a lot of speed, de-risk, and other capabilities. Managing your own team gives you other ways of control. But I would say think differently, and what worked 5-10 years ago doesn't work now. And so take a moment, understand the regulatory landscape, understand the incentives you're doing in your organization, understand what you really need and your capabilities gaps, and work from there. Don't just dust off the old playbook and go.
You bring up an interesting point, because I know we talk about customizing the approach based on each situation, each product, each company in particular, but how do pharma teams balance scale and a customized approach? It's easy to say that, but it's hard to deliver both of those things. So how would you advise companies looking to balance that?
I think Kim and I are going to answer this one very differently too. Kim's going to talk about the human capital side of balancing that, and I'll be on the tech side. We talked before about having a plan for innovation, and customization is a close cousin to it. When a manufacturer insources, the IT team is going to want to think about standardizing the services and make everything flow the same way. And I think we all know in patient access, each brand has unique needs. And most organizations will then try to create custom one-off solutions for a brand. And the next thing you know, they got a jumbled mess on their hands because they've got 14 brands and 15 ways of doing things. And they treat the commercial business with a different workflow than the Medicare business. Again, with where technology is going, a lot of that customization can actually be done outside of Salesforce. There's ways to partner with third parties to have them managing some things that may be complex workflows for a specific brand that are outside of Salesforce and the system of record. So not every experience needs to be in the Salesforce platform. It needs to be the system of record. It needs to be the source of truth for a brand. But there's lots of things in these hybrid models that you can do through business rules and things of that nature that will create the customized experience the brand needs without the complexity in Salesforce.
Kim, what's your perspective on the balance?
I think the common thing with every new launch is it's a unique snowflake and needs to be approached that way. And I'm a big believer in the 80-20 principle. There is a lot of overlap in approaches, so you can take things you have from other programs, like Rick is saying, and then modify from there versus always do ground up. That's going to save you a lot of time and energy and learning and training. And I would say from a human capital standpoint, what do you really want your team doing? And building tools to wrap around that. So if you have a field reimbursement manager, which is someone that has that face time in front of a HCP and their staff to assist patients with pull-through and understanding patient coverage and navigate the web that is obtaining access for patients, it doesn't always have to be in person. It can be a component virtual, and I think the next step in the technology is using AI agents to do that first touch point and answer questions for them. And so where do they need to be? What is the right channel to reach them? Because you get much more reach with a virtual or using an AI agent. And when you are sending them to the right place with precision targeting, do they know what to do, or are they spending a lot of time doing research? And so creating next best action reports that look at the HCP payer landscape, policy in the area, cases that have come through the hub, cases that are sitting with pharmacy, whatever you have access to, and directing them on what they need to talk about to handle the problems today and to be predictive and coach them so they don't make the same mistake tomorrow. And that's how you get scale. I see these teams often get deployed to be reactive and handle a case. You don't scale enough. You don't support a high volume of patients that way. What you end up with is a nice KPI that says we touched X cases per day or per week. That doesn't necessarily lead to an outcome. You have to think about what message, right person, right place, right tool, and design it that way, and then keep measuring it to make sure it's working. And we had a talk earlier this week about the rise of specialty in Gen Med. You cannot support Gen Med with all human capital.
Right.
There's 1 million prescribers. So in those spaces, you have to be very intelligent, supplement, like Greg said, get in their workflow and make it easy. And you have to use technology and just be smart about where these things are deployed.
At the end of the day, you guys both almost ended at the same spot, right? And there's a blend of human capital and technology. So final words, I want to give the audience a moment if there's anything you'd like to share about either of your organizations and how you're continuing to help patients and patient support services moving forward.
Yeah, at CareMetx, we have really invested heavily in an underlying middleware infrastructure that will help our customers move closer to providers and patients. We've invested heavily. So we talked about that app store. We built out that app store. We've got 28, 29 EMR and practice management integrations that allow their providers to use the existing data. It does amazing things from the provider standpoint. An enrollment form might take 20 minutes to manually fill out. It takes 90 seconds when they're integrated into the EHR because they don't have to take all the data. You can sequence transactions and you can accelerate the patient journey as you move closer to the providers just because you can do things so much quicker. That's exciting because it's going to do nothing but benefit patients. The other thing you get out of it is more data markers. What if you start to know when the next scheduled appointment or the next scheduled treatment is, or when you can actually get a treatment confirmation that the injection happened or the infusion? So excited about that sort of stuff. I think it's going to start really moving patient services out of that centralized call center we started the conversation with and into the workflow of providers and patients.
Awesome. Kim.
We love a shameless plug. Patient support is a priority for Syneos. Where we're investing heavily is, again, in technology. Everybody is. But what is our X factor is it's people powered by technology. And it's how we show up as an organization. So we work together all the time. You're in consulting, a thought leader in the market, and I'm putting together programs and executing and deploying them. That is the X factor, is the full commercial integration and showing up as a coordinated team. I don't think you get that experience with other organizations because they don't have that scale and breadth of support services. And what that delivers is a non-transactional. It's a transformational experience, and we're able to jump in and solve problems for customers very quickly, even if it's not the remit of the role. And we can close all their capability gaps. So to me, that is different. That was part of the reason to come to Syneos 10 years ago, is being able to have those full capabilities and deploy a program from vision to reality. I'm excited about that and all the new technology and things that are coming our way to keep making sure we're giving the right people the right process, the right technology.
All right, so at the end of the podcast, we always like to end with something semi-controversial. So I'm just going to throw something out there and get both of your reactions to it. In 10 years from now, do we think that everything will be an AI solution or tech-based solution, or do we think that there will always be a need for human intervention?
I think things like AI, we're at the beginning of it, but I don't think it is going to eliminate the need for patient touch, empathy, the things that so many professionals in our industry do every day because they care about a patient. I don't think the bots ever get to that level. I think they'll continue to make us better, improve the quality of the services we deliver. But I think you're always going to have it, just like I don't think there are people that think the bots will take over the physician's job too. I don't think it takes it quite that far.
Kim, and by the way, I just want to confirm you are not a bot.
I am not.
Okay, all right.
Or that's what I've been programmed to say.
That's perfect.
I'm not sure. I think the first wave is people who don't adopt technology will be replaced by people that do. And we talk about that a lot on my team. So that's wave one. And I do think it's already happening today. And it started years ago with omnichannel. There will be less human capital to get things done, but I think it's going to be more meaningful interactions. Like, people have a lot of administrative work, research time, thinking. That's all going to be eliminated. And the people that are out there touching patients, it doesn't stop. They're just spending more time doing it. So that's what I think. We'll see. I'm all for it if it means I don't have to. We talked about it. There's an AI bot of me that answers questions and I get the check when I'm home. I'm okay with that. But I don't think human resources will ever go away.
Well, you heard it here first, and I want to thank both of our guests for joining today. Thanks. That's a wrap.
Thank you, Michael.
Thank you.
That's all for today's episode of the Syneos Health Podcast, Navigating Modern Market Access. I'm your host, Michael Sarshad. If you have any other topical issues you'd like to hear on this podcast, please send us a message at podcast@syneoshealth.com. For access to more future-focused, actionable life science insights, please visit the Syneos Health Insights Hub at insightshub.health.